Hello?
Hello, sir. I'm Dr. Henry.
I'm a lady.
Oh, excuse me. My name's Dr. Henry. So can you tell me what brought you in here today?
Well, I have arthritis, and that's been acting up a little bit, but I've noticed that my hair's starting to thin. I'm getting a lot of acne, a lot of fat on my face and my back. I've had this wound, I shinned my knee, and it hasn't healed yet. It's been like a week. I'm bruising very easily. I have this big bruise. All I did was bump the counter.
Oh my.
And now I'm getting stretch marks. 74 years and I haven't had stretch marks.
Okay, so we're gonna run a few tests on you to see what's going on with you, okay?
Okay.
Okay.
Hello?
Good morning, sir.
Sir, I am a lady for the 1000th time.
Oh, I apologise. So Dr. Henry ordered some tests that we're going to run here, just to verify what she's thinking.
Test what tests?
Well, the first one's going to be a 24-hour urine, blood, and salivary cortisol test.
Cortisol?
Yes, it's to check your cortisol levels. If they're high, it could be an indicator of Cushing's syndrome. We're also going to do a dexamethasone suppression test. And we are also going to do a CT and an MRI to rule out the possibility of a tumor.
A tumor? I have cancer?
No,
Oh,
that's what the doctor wants to rule
don't
out.
scare me like that.
So we will get back to you whenever we have the results.
All right. Sounds good.
All right.
Thank you. Attractive. Hello.
Hi, Martha. So, we have come back with your lab test, and it showed that your white blood cell count was high,
Okay.
your sugar was high, and then the cortisol levels in your blood and urine were also high, and then your potassium is low. We've also ruled out any tumors, so you don't have to worry about cancer.
Oh, did you hear that?
Oh, that's great. Okay, so we've diagnosed you with Cushing's disease.
Cushings? I've had plenty of cushions at home. I don't need any more. Send them back.
This is different from the Cushing's you have. This is a hormonal disorder caused by the prolonged or excess exposure to cortisol, and your prolonged exposure to steroids from your arthritis probably led to this.
Oh, I see.
So with you being 74 and a female, your chronic use of steroids has led to this.
A female, yes. You're the first one to get that right today.
The adrenal gland is also responsible for the excess excretion of cortisol.
Okay.
So that's what caused this disease.
I see, I see.
Okay.
Thank you very much.
So we're going to have to slowly wean you off of your steroids. And
All
you'll
right.
be under close medical supervision.
Okay. Did you
Okay.
understand that?
I think so.
Well, that makes
So
one
she
of
won't
us.
have to shave anymore?
No, you will not have to shave
No.
unless
What about
you,
this right now?
unless you don't like your facial hair.
I mean, it's growing on me.
Okay. Well, if you don't have any questions, then I'm going to get out of here, okay?
All right.
All right.
Thank
Thank
you.
you.
Come on, Kaylee. I'm sick of this place. Let's go.
Grandma, it's Kaylin.
Well, we'll get it right eventually.
We're out here in the Badlands of Oil City, PA, looking for the infamous Martha, a newly diagnosed patient with Cushing's syndrome. What an extraordinary opportunity it would be if we could have a word with Martha. I wonder where she may be. Oh, by George, would you look at that? Is that you, Martha? Oh, what do you want? Oh, croaky, Martha. You're smoking a cigarette.
Yes?
You know that's not a good idea. It may increase your disease progression.
Oh, posh. I've been smoking for 74 years.
Well, you definitely should consider quitting, ma'am. It's also a good idea to maintain adequate nutritional intake, making sure you're eating healthy foods. You also want to make sure you're getting enough fluid intake, but monitor for fluid retention. Check your weights daily.
Can you back up a little bit? I have a whistle.
Check your weights daily and monitor yourself for signs of swelling. Martha, it's important that you stay aware of your emotional health, as Cushing's syndrome is known to deteriorate this.
Emotional. You're making me emotional right now.
Well, I am sorry, ma'am. It's important that if you have any of these problems that I've told you about, to report them to Dr. Henry immediately. Do you understand?
Yes?
Good.
Wait, you didn't even ask for my number. I cannot understand these drugs for the life of me. Ketoconazole sounds like I'm trying to stuff a cannoli in my mouth.
It's okay, Grandma. I'm going to help you understand. They gave us this handout at the doctor's office. These medications are using to suppress your adrenal function. This will help lower your cortisol levels and improve your Cushing's syndrome.
Okay.
The medications they have provided are Nizoral, Lysodrin, and Cytodrin. The Cytodrin is an anti-steroid drug specifically. Some of the side effects could be drowsiness, nausea, anorexia, and dizziness, so we can't drive anymore.
Well, you know I haven't driven since I've got my fourth DUI. So, if I'm correct, then Cushing's is caused by high cortisol levels and excessive steroid use. So I need to work out, eat healthy, drink more fluids, stop smoking, which I really don't want to do, and I need to take my medication the right time and effectively. And if I start going crazy, you'll tell me, right?
I'll tell you.
Okay, I won't like you for it, but I understand. Well, I guess that wraps it up. I need to make sure I stay healthy so I can live a long life with my Kalilu, and I can win all those boys over from Zumba.
There you go.